Hello, thank you so much for your interest in our program at Indiana University. My name is Charlene Benty and I'm the program director, and I'll be giving you a little bit of an introduction to our program before we have the privilege of meeting you during our interview days. Our chair of our department is Dr. David Wallace. Our associate program director is Elizabeth Martin, and our program coordinator is Mallory Mack. Our program has full ACGME accreditation. We have 6 residents a year for 4 years, so we are a fully integrated PGY 1-year program. And we are the only training program in Indiana. As you'll see throughout this talk, there are plenty of perks that come with us being the only training program in Indiana, particularly having to do with the volume and the pathology that we see. 1/3 of all Indiana ophthalmologists trained at IU. So there's this nice built-up community within our state of referring physicians and also partnering physicians and optometrists that we share patients with. And the department was established in 1908, so there's a lot of history and legacy within this department. Just right off the bat, going with the highlights. As I mentioned, the biggest perk is really kind of the volume and the depth of the pathology that you see. You train in a diversity of settings. We have a VA hospital, a county hospital, a children's hospital, and also private practice settings. So you really get a taste of all different settings. You get meal cards and a book stipend to help with meals while on call, and also book supplies and lenses. You do have time set aside for interviews, whether that's for fellowships or jobs in your PGY 3 and PGY 4 year. All PGY 4s are also allowed to attend the AAO conference annually, and you're supported with funding and time off for that. PGY 4s also get to attend a LASIK course each spring with time off to learn kind of the nuts and bolts of LASIK. If you are presenting at a conference as primary presenter, we do, again, in addition to vacation time, support you with time off as well as funding to support the trip as well. Every spring there's a resident retreat where the residents get together and just have a good time away from work and get to just kind of rejuvenate and spend some good social time together. And then finally, there is an international ophthalmology opportunity that I'm sure many of you are interested in. Perhaps arguably the biggest highlight of our program is Mallory Mack, who's our wonderful program coordinator, who many of you have had the opportunity to interact with already, but she truly is just the highlight of our program. She's just a pleasure to work with and deeply cares about all of our residents. This is her wonderful husband, Ray, who's equally as wonderful, so we are very lucky to have Mallory here. Another one of our highlights are our facilities. So the Sidney and Lois Eskenazi Hospital is a county hospital, and it might possibly be one of the most gorgeous hospitals you set foot in. It's new and state-of-the-art. It has beautiful facilities. The clinic is very well stocked. There's a garden, a rooftop garden on top of the hospital that they use some of the produce in their dining areas in the hospital. There's also a Starbucks there as well. The Glick Eye Institute is kind of your mothership, and this is another very beautiful building that you spend a lot of your time with lectures, and you've got clinic there, and then a lot of the administrative offices and wet lab and simulator are there as well. As far as the international ophthalmology opportunity goes, we are partner with Orbis International, which is a nonprofit organization, a very well-established nonprofit organization that provides eye care all throughout the world. We're lucky to have Dr. Dan Neely, who is one of our pediatric ophthalmologists and the senior medical consultant to Orbis. So we have strong ties with Orbis International. And you are allowed a 1-week elective during your PGY 3 or PGY 4 year. You work aboard the Orbis Flying Eye Hospital as an associate ophthalmologist, and also get to get your feet on the ground there and help out with some clinics and ORs and surgical opportunities as well. You're allowed 1 week off for this time, again outside of your vacation time, as well as with a $1,000 travel stipend. Orbis does provide a lot of resources once on the ground. Tying nicely with our own departmental international ophthalmology opportunity is the IU School of Medicine Global Health Track. So this is something you apply to at the end of your first year, And this provides you, if you're really interested in a career in international ophthalmology, this is really a program that provides a curriculum to help prepare you for that. There are quarterly conferences where you talk about different healthcare topics, global healthcare topics, as well as things like ethics, and just very important things that you should know if you are interested in a career in international ophthalmology. You will receive mentorship while on this if you decide to pursue this track, and also will pursue a scholarly project related to international health. This can tie in very nicely with your research requirement for trainees day in our department. And then we would like for you to do an international or local global field experience as part of this track. And the Orbis trip, of course, ties very nicely into that. But if for some reason you're not able to go, we can think of a nice local global field experience for you. So our PGY 1 year is fully integrated. So this is great that you enter as a PGY 1 here at IU, and you'll get to know a lot of the residents and the facilities and kind of how the system works before you even start in the thick of it of your ophthalmology years. You have 3 months of ophthalmology, and then the majority of the remainder of your rotations are spent at the VA hospital, which is where you spend a lot of your ophthalmology rotations. So it's a great precursor to your PGY 2 through 4 year. And then you do spend 1 month at the IU Methodist ER, where you will also spend a lot of time as an ophthalmology resident and get to know some of the residents and faculty there. This is what your PGY 2 through PGY 4 years look like. Of note, you'll notice you spend a lot of time at the VA and Eskenazi. These are all resident clinics, which is a huge advantage for you to work together as a team and really kind of help each other out and get to know each other and be each other's support while you kind of bust through these very busy clinics with a lot of pathology. You'll also note the consult to night float rotation, which many of you may have questions about, so I'll speak a little bit about that. So this is, you spend 2 months on this consult to night float rotation, both in your PGY 2 and PGY 3 years. You can split this however you would like. So you can spend 2 weeks on days and 2 weeks on nights, or 1 month on days and 1 month on nights. You just work as a team with your corresponding PGY 2 or PGY 3 resident and sort of serve as each other's backup and help each other out and determine what works best for both of you. This is covering just Methodist and university daytime consults and then all hospital call overnight. The night float runs from Sunday through Thursday, and then the remainder of the weekend time are regular call shifts split between the PGY 2s and PGY 3s. To kind of orient you to the city of Indianapolis, this is what it looks like. It's surrounded by a highway called 465 that kind of encircles the whole kind of Indianapolis metropolitan area. Our Indianapolis is called the Circle City, but in fact it's not because of this 465 highway that circles the city that many people may think. It's actually because of the many beautiful monument circles in our downtown that we hope you get the pleasure of visiting at some point. Here is kind of a bird's eye view of our medical campus, our IUPUI medical campus. As you can see, there's this kind of quad that everything is centered around with a lot of green space, so really has that kind of college feel. The Glick Eye Institute, again, is your mothership, and then all within a 5-minute walk are other hospitals that you'll be spending the majority of your time at. The VA hospital, the Eskenazi hospital, Riley hospital, IU hospital are all within a 5-minute walk of each other. So it just gives such a nice feeling of a campus and a nice kind of safe medical campus. About a 5-minute drive north is IU Methodist Hospital, and this is where you spend time doing consults and overnight call as well. About a 20 to 30 minute drive are some of the other facilities that you'll be spending time at. And these facilities have a little bit more of a private practice feel for you to have exposure to that, which is a different feel. But very, very important and beneficial for you guys to experience. So the Glick Eye Institute at Spring Mill is our sort of north side location. And then the Price Vision Group and 2020 Institute is where you'll have your refractive and some cornea experience as well. Our faculty is stacked with wonderful human beings who just care so deeply about your education. We have 4 full-time comprehensive ophthalmologists, Dr. Aitchen, Eikenberry, Young, and Waddell, 2 of which are at the VA. Our cornea and refractive surgery specialists include Dr. Fang, Liu, and Valuri, and once again, you'll spend time at the Price Vision Group as well as 2020. We have 5 wonderful glaucoma faculty, Dr. Cantor, Dr. Katora Boyle, Dr. Lind, Martin, and Schrader. And we are lucky to have 4 neuro-ophthalmologists. One of them being a pediatric neuro-ophthalmologist who are very hard to come by. That's Dr. Melissa Koh. Dr. Lai, Mackey, and Pervin do adult neuro-ophthalmology. Our oculoplastics faculty that you'll work with are Dr. Burgett, Clapper, and Lee. Dr. Lee heads the ASOPers Oculoplastics Fellowship. We have a very large and robust pediatric ophthalmology group. I am not biased, but this is the best division of our department. We have 8 of us, actually, and we just have, as I mentioned, we cover essentially the entire state. We're the only pediatric ophthalmology group in the state, so we get a lot that comes through our door. Dr. Plager, myself, Dr. Hyder, Neely, Roberts, Smith, Sprunger, and Wallace are all part of our pediatric ophthalmology group who you'll have the pleasure of spending time with in your PGY2 and PGY4 year. Dr. Hajrasulia, Yusabegovic, and Minturn are our retina and vitreous faculty who you'll spend time with. There's also a retina fellow. And then we just had Dr. Victoria Miller join us as a uveitis faculty, so we're super lucky to have her on board. Dr. Jose Benin is our ocular pathologist who you will have ocular pathology lectures with. And then we've got 6 wonderful optometrists who we very closely partner with both on the adult and ped sides, Dr. Ghosh, Pickett, Polster, and Dr. Donaldson, Graves, and Jones. We're fortunate to have a very active and involved research faculty, Dr. Bhatwadekar, Corson, Das, Mrs. Imanishi, Dr. Mr. Imanishi, Dr. Lowe, Mao, Padabiraman, and Sharma. They're all wonderful individuals who also care very much about our residents' research efforts. So you will have opportunities to partner with these faculty if you decide to pursue any basic science research while you're here. As I mentioned, we have a few fellows, 2 pediatric ophthalmology fellows, 1 glaucoma fellow, 1 oculoplastics fellow, and 1 retina fellow. I think I can safely say that the residents would agree that these fellows do not take away from your surgical experience, and in fact, they absolutely augment your experience as a resident here. We have a number of volunteer adjunct faculty who also help with consults, your low vision experience, as well as your cataract surgery. So Dr. Brazis, Habel, Karadia, Latona, and Robinson, we are very lucky to have affiliated with us. Resident wellness is a topic that's near and dear to my heart and something that's very important to our program. As part of these efforts, we allow a 1/2 day per month administrative day just on our IU rotations that is protected time for our residents to do whatever they would like. So you can go to doctor's appointments, you can sleep, you can spend time with your kids. We've had residents go to other clinics, so it's really your time to do what you want. We also participate in something we call opt-out wellness checks, where each resident is given an appointment with a mental health counselor, and it's completely confidential, and I don't hear anything about it, but it's up to you whether you want to opt out of that or not. And again, I don't hear at all whether you opt in or out for that, or whether you opt out or whether you attend that appointment, so that's up to you. Feedback from our residents is very, very important. I believe that this program is built by our residents, and so to have our residents have input in major decisions is super important for me. We have quarterly resident QI meetings where we talk about any issues that may be coming up and just kind of talk through some of the things to make things easier and better for everybody. We have an anonymous suggestion box. If a resident has a concern that they don't feel comfortable approaching me or any of the other program leadership about, we absolutely encourage our residents to use the anonymous suggestion box to come forward with these concerns. And then we do have our annual resident retreat, which I think really contributes to the wellness of our residents in the springtime, where all residents get a day off to just spend some fun time together. Diversity, equity, inclusion, and justice. This is another topic that is very important to our department and very near and dear to my heart. So we are doing a lot. This is an area where I would say we are expanding and growing and learning at a very rapid rate. This is a long list of some of the efforts that we have been putting forth in the last couple of years to really kind of make this a robust, deliberate, and intentional effort for us. So application season is a big one. We want to recruit a diverse class. I will say that last year, with these efforts, close to 30% of our interviewees were underrepresented in medicine applicants. All of our interviewing faculty have or will undergo unconscious bias and equity and hiring training prior to interviews. And we also target our medical students and do early outreach to identify medical students who may be interested in ophthalmology who may have not otherwise been exposed to ophthalmology. So we do a lot of events locally on our campus, as well as regionally and across the country, to kind of just help put out a word about ophthalmology and how great the field is, and try to reach as many applicants from diverse backgrounds as possible to really kind of turn people on early and help them prepare and mentor them for an application to ophthalmology. We have initiated a quarterly DEIJ speaker series in our department grand rounds. So these are a couple of our examples of our most recent sessions. But a big belief is that education is where things start. So all of us have a lot to learn, and we do this by coming together as an entire department that includes our trainees, our residents, fellows, faculty, and staff to talk about these topics. We've encouraged our trainees, our residents, to pursue their research projects and incorporate topics about health inequities or incorporating social determinants of health in their topics. And we've had a handful of residents take that up, so we're looking forward to this year's Trainees Day to hear about these topics. We've asked our didactic speakers to touch on healthcare disparities in the medical topics that they are talking about. And we also are very conscientious about our speakers that we invite to our department from outside either departments in IU or across the nation to speak. We make sure that these speakers are represent a diverse backgrounds and have different points of view to bring to the table. We have a very active student outreach clinic that's led by our ophthalmology student interest group that residents and our faculty also attend, where this student outreach clinic is really meant to reach the underserved in our community. We do participate in the AUPO-AAO Minority Ophthalmology Mentoring Program. And then once COVID eases up on us a little bit, we will be participating in our underrepresented in medicine visiting elective program, where we help to sponsor and provide support for visiting medical students from underrepresented backgrounds to come visit and do an away rotation with us. This is a composite of our current residency class, spanning from our PGY1s to PGY4s. We have a fairly consistent statistic of 4% of our residents being underrepresented in medicine. This is both when we had 18 residents and now with 24 residents. We, of course, would like this to be more, as we all know that having a more diverse workforce improves patient care ultimately. Right now, it is split 50% female and 50% male. 20% of our residents are with or expecting kids, and the majority, but not all, live downtown, so really close to the hospitals. And then the majority, but not all, are not married. And then all 100% are super fun, so there's no concerns about that. Our recent graduates over the last 5 years, so 27% of them practice in Indiana, which I think is fantastic. 50% pursue fellowships versus comprehensive, and this includes our underrepresented in medicine graduates. If you haven't already, I urge you to follow our social media pages on Instagram and Twitter. It's IU Ophthalmology, and you'll get a much better taste of how life is as a resident here and just how social our residents are together, which I love to see. For those of you who have not been to Indy, what to do in Indy. So I have lived here for almost 6 years now and truly love it and don't see myself leaving. It's a very comfortable Midwest city and really easy to live around and a wonderful place to train. We have 11 professional sports teams, and there are plenty of museums, restaurants, music, and theater here as well. So our beloved Indianapolis Colts, this is at Lucas Oil Stadium, which is they have a retractable roof, so a wonderful, pleasant environment to watch football if you desire. We have the Indiana Pacers as well as the Indiana Fever, our WNBA team, and they play at the former Bankers Life Fieldhouse, which is pictured right here. The Indianapolis Indians is our minor league AAA affiliate of the Pittsburgh Pirates baseball, and this is a really fun place to watch some baseball for the summertime, and they've got a nice little lawn that you can just kind of relax and hang out at. The Indy 11 is always a really fun activity to attend. Indy 11 is in the United Soccer League, which is Division II under the MLS Division I, and then the FC Indiana is in the United Women's Soccer League Tier 4 league. And then of course we have our Indy 500, which comes to our city every May and is just a spectacle of people and a huge sort of city-wide change event, which is really, really fun to be a spectator at. As far as museums go, we've got our Indianapolis Children's Museum, which is actually the largest children's museum in the country. So if you have young kids, or even if you don't, it's just a really fun place to be at and visit. There's Newfields Museum, which is an art museum, and they have a wonderful winter lights exhibit every winter. Right now they've got the Van Gogh immersion exhibit going on, and they do a wonderful fall harvest festival as well. These are shots of downtown. So that's the canal, which is a wonderful place to just walk on a nice day. And then this is an area, White River State Park, that has a lot of concerts and live music to attend. This is Mass Avenue, and then as well as the Garage Indy, which are two great food locations with lots of restaurants, lots of casual and fine dining options. And then our state parks are very frequently visited by our residents and faculty, which are very easy drives to get to from downtown. So thank you very much. This is a picture of our department when we were able to have our trainees day all together pre-COVID. But we really, really look forward to finally meeting you virtually. That's the best we can do for this year. And if you have any questions before the interview day or after, don't hesitate to reach out to us. Take care.